Hello guys, I welcome all of you to today's PYQ Shots, and let's begin with today's question guys. A patient consumed 8 tablets of digoxin 0.25 milligram tablets each. He develops third degree heart block with a heart rate of 56. Which of the following would be best for management, right? Look at the options. Option A, cardioversion. B, lidocaine. C, phenytoin. D, digipine. Pause the video guys. Let me know the answer in the comment box. Then we shall begin the discussion. Right. Coming back to this question, here your answer is undoubtedly digibind. D for digibind is the answer because the patient what he has developed is called as digoxin toxicity. Digoxin is a very important drug for your exams, guys. So let us see what are the PYQs they have asked with respect to digoxin. Number one, digoxin. What is its mechanism of action? It blocks sodium potassium ATPase pump. That's a PYQ, fairly easy one which has been asked. Second, what is the time taken for digitization? So whenever they ask what is the time taken for digitization, it means how much time is required to achieve the steady state concentration, right? I need 4 to 5 half lives. Digoxin has a half life of 36 to 48 hours. So whenever they ask what is the time required for digitization, your answer is 7 to 10 days. Yes guys, your answer is 7 to 10 days. PYQ number 2. PYQ number 3, with respect to digoxin, what they ask is uh, what is the earliest sign of digoxin toxicity or the most common sign of digoxin toxicity? Your answer is nausea, vomiting. So earliest or most common sign of digoxin toxicity, nausea, vomiting. PYQ number 4, which drug can cause xanthopsia or yellow vision? Again, your answer is digoxin. PYQ number 5, what is the drug of choice for digoxin toxicity? And your answer is digibind. So digibind is anti-digoxin antibody, is the drug of choice for digoxin toxicity. PYQ number 6, for which drug I cannot do dialysis in toxicity? Again, your answer is digoxin. So remember, D for digoxin, D for digibind, D for dialysis. One can be done, one cannot be done. So these are the PYQs which have been asked with respect to digibind. Look at other options. Cardioversion. Uh, can I do cardioversion in digoxin toxicity? No, guys. Cardioversion is contraindicated in digoxin toxicity because the arrhythmia, like ventricular tachycardia or fibrillation of digoxin toxicity, can be further worsened by digoxin, right? Option B, lidocaine. What are the PYQs which have been asked with respect to lidocaine? So lidocaine, the only MCU they ask you, this is the only one, is what is the drug of choice for ischemia induced ventricular tachycardia? In place of ischemia, there can be angina or myocardial infarction. It's the same thing. Your answer is always lidocaine. PYQ number 2, what is the drug of choice for treatment of digoxin induced ventricular tachycardia or fibrillation? Again, your answer is lidocaine. So remember why lidocaine is not the answer here, because here we are not talking about ventricular tachycardia, rather there is bradycardia because of block. Uh, Option C, phenytoin. The only use of phenytoin is again for treatment of digoxin-induced ventricular tachycardia. So in this case, our answer is digibind because it's a case of digoxin toxicity. Digoxin is an important drug, guys, and that is today. That's all for today's PYQ shots. Tomorrow I'll be back with another PYQ. Till then, take care. Bye bye.